Well, hello, everyone, and welcome to the Living Well podcast. Today, I have a very special guest I'm super excited about, Dr. Jill Crista. She is a pioneering naturopathic doctor, best-selling author, devoted educator, and creative innovator. Her superpower is to make complex medical concepts simple and digestible for the average person. Dr. Jill's passion is to elevate the well-being of the planet by assisting in the healing of her inhabitants. Her books and online courses support those wanting concrete steps to conquer health challenges. Dr. Jill focuses on conditions that cause injury to the brain and nervous system, including mold, pandas, Lyme disease, and concussion. So, welcome, Dr. Krista.
Thank
So
you.
happy
Thank you
you're
for having
here.
me on your podcast.
Yes. So, I thought we would just start off kind of with the basics for those who might be listening and feel like their own health or the health of a loved one, a child maybe, um, is just out of control, that they are not getting answers. They've spent lots of money on different treatments for different things and are getting nowhere and feel like they're losing their head. Um, what would you say to them that, hey, this could be possibly mold that could be causing it? And you're an expert in this field. So I mean, you are such a great forerunner for this. And I love how you explain things to lay people because it is easy to digest. And yeah, what would you say to someone that you meet that would say, I'm having these concerns and feel like I'm going crazy? There's no answers.
Yeah. When you're doing everything reasonable and not getting the expected results, that's usually when I start thinking about mold as the thing behind. It can cause any symptom in any system of the body. So that makes it very difficult to find it. That's why it hasn't been recognized, because if you get sick from mold, you're going to look different than your best friend is sick from mold, from your twin who's sick from mold, from your child, your partner, the person working at the desk next to you in the same moldy work building. Everybody will express that exposure differently. That is the norm. That's not an exception. That is normally how it goes. So imagine trying to pick up a condition where you're like, well, what's the criteria to be able to diagnose this? And it's a list, a mile long of potential symptoms. It gets really complicated. But there are kind of a cluster of symptoms that we might start to, it's pointing more and more and more arrows to, oh, you really need to rule out mold, as one of the things. And part of that cluster is fatigue. Fatigue is found in almost every case of mold-related illness, especially when they're getting more of the toxin-based exposure versus the spore-based. And we can talk later about like, what does that mean? What am I talking about? So fatigue is really huge. And that might look like a very high-functioning mom who's juggling a lot of, or spinning a lot of plates, juggling balls, whichever way you want to say it, kind of keeping up, but absolutely has to get that nap when the kids are napping, or you're just not going to make it through the rest of the day. And you fall asleep before the kids do when you're reading for them. I mean, that can be like a normal mom thing, but if it's really accentuated, and if you are truly a wreck, if you don't get that extra nap, or somebody who's a competitive athlete and they don't have as quick a recovery. So if you're a competitive athlete, you're monitoring all those things. So this fatigue can look very different depending on where you are in the world of your own fitness, but also your genetic susceptibility. Some people don't really feel as much of the fatigue. They'll say, oh yeah, I guess I am a little more tired, but my brain isn't working right, or my eyes aren't working right. So those are two energy intensive organs and parts of our body where that fatigue will show up first. So it can be kind of like your brain, they call it brain fog, but it's also almost like low fuel. So it's like your brain runs on low power mode, or you run out of energy in your brain. So you can make it for a little while, like the conversation we're having, and at the end you're having trouble with word finding. Like that could be where you are showing the fatigue. It can also be with the visual system, a lot of changeable vision, or you have to get new glasses or get contacts, and your eye doctor is saying, we're seeing signs of aging. Well, that's what mold does. It enhances the aging of the eyeball itself and also changes the visual processing. The other place fatigue can show up is in the heart. because the heart is also a high demand organ. And so if we're getting the effects of fatigue on the mitochondria, which is what the technical thing that these toxins are doing, some people can get actually heart symptoms. So chest pain or palpitations and those kinds of things. So those are, we think of fatigue as sort of like tiredness. So that certainly can be the way that it shows up, but it can also show up as brain tiredness, eye tiredness, heart tiredness. So fatigue, think of that as like a bigger umbrella. We see a lot of ear ringing with mold, which makes sense because a lot of the medications that have ear ringing as a side effect are made from mold. They're actually the mold toxins that we're talking about. So when people take these drugs, they can get ear ringing. Well, if you're breathing that same chemical in your indoor air, you're going to get the ear ringing. That's a really, really common one. We can see some lung sensitivity. Of course, if there's a lot of spores in the air, you'll see more allergies, sinusitis, postnasal drip, somebody who has to wake up in the morning and kind of clear their throat. And it takes, maybe a couple hours before they just have a clear throat. Asthma is highly correlated to mold spore exposure. And then a lot of gut stuff, a lot of gut disruption from the mast cell activation that can happen when you're exposed to mold and the toxins, and also the toxins themselves and their effect on the gut. And then the really, really common one is urinary sensitivity. So someone who's can't stay hydrated because they're peeing all the time, or they feel like maybe they have a bladder infection, but they go to their doctor and they test it and it's completely clear of infection. And then we can also see skin rashes. So if we're kind of looking at that cluster, if we're seeing somebody that has that cluster of stuff, we're going, oh, okay, that's a lot of arrows pointing toward possible mold exposure.
Mm-hmm. No, that's really good because I think, I worked in the conventional medical system for many years. And I'm thinking, when you say like bladder sensitivity or anything, like unfortunately, the way our, medical schools are and how they typically train is to treat the symptoms. And I think of, prescription, there's a prescription written for the interstitial cystitis or whatever it is, and not ever looking further. And then, of course, those medications cause more side effects of different things. And, medication upon medication just compounds things. And then there's a person that, 20 years down the road, they've been taking all these different medications and keep having to add more, and their health has continued to suffer. And yet we think this is normal in our country. And we are, a wealthy, wealthy nation, but yet we are getting sicker and sicker. And we have, it just blows my mind. Like, and I will say, like, COVID really opened my eyes to, because I was able to step back and I had a paradigm shift and woke up to what was wrong. And I was part of the sick care system. And so, there are
Uh,
well-meaning people in the system, but when you're
Most are.
yeah, yeah. So
Yeah.
it's not like I'm not, bad mouthing the doctors and nurses who I worked with, or, pharmacists, but it's like when you are shown the truth about things, you've got a choice to make. And are you just wanting your job security, or are you what it's like I can't go back to working in that. I mean, there's some good things, but the majority, it's like with chronic diseases,
Mhm.
it's just continuing feeding the medical industrial complex. And anyway, that's a whole nother side note. I don't want to get off on that, but
But it's important because it's treat the cause or treat the symptom,
yeah.
when you stop to think about that, most conventional medical schools now are funded by pharma.
Hmm.
So what are they going to be teaching? How to be a good pill prescriber. And there are only three of the medical schools of the high tier that we'd be thinking like Columbia, Georgetown, that teach even one nutrition class. And so we're really, really, really missing the boat. So when people are like, oh, but I see the top level, blah, blah, blah. Well, realize who's training them. They're
Exactly.
the people that have some skin in the game on them being a very good prescriber. And
Right.
so we're not trained with the right intention, which
Hmm.
is to get people well, not to keep them on the prescriptions.
Right. Right.
Mhm.
It's total paradigm shift with the way you
Yeah,
look.
right. We're supposed to be working ourselves out of a job, you
Right.
know? Yeah.
So kind of like what that made me think of is, okay, with COVID, because you hear about long COVID, and what have you seen with, people that come to you thinking they just, their symptoms like that kind of might be considered long COVID, and how is that, interacting with possible mold
Mhm.
and
A
mycotoxins?
lot of crossover, a
Hmm.
lot of crossover. What's a little bit different about COVID with long COVID is that if you look at the studies, and if anyone is interested, I have a whole series on COVID that you can just email me and we'll give you the whole email series that I did, which was, here's the research, here are the findings. COVID does not cause myocarditis, but something else that came along afterward does. So, just really teasing apart the actual research and the data. There's a lot of crossover between chronic Lyme and co-infections, mold, and long COVID. So a lot of people that were already working in chronic Lyme, like I was, and working in mold, we had a lot of success with COVID because we were like, oh, this is causing hypercoagulability. That's what Lyme does. That's what mold does. And it's not just more clotty blood. That's what hypercoagulability is thicker blood, basically. But it's also causing blood vessel instability, which blows our minds in medicine because someone is either a clotter or they're a bleeder. They're not both. But these conditions caused clotting bleeders, which is just like, then which medication do we give them? Because that doesn't make any sense.
Hmm.
And when you step back to natural medicine and you realize, oh, okay, it's injuring the inside of the blood vessels. So we need to support that. And that can be done beautifully with natural medicine. I also have a whole series, or it's three different blogs on my website. If you search vulnerary, VULNERARIES or Y at the end, there are three plants that were studied having antiviral activity against COVID, but also at helping to turn the cells over on the blood vessels. So that stability part of the blood vessels is really important, and also thinning blood. And then the other thing we see with COVID is it reduces certain types of energy production in the body. Mold does that through mitochondria, which is our basic energy system that makes our ATP and things like that in every cell of our body, except for red blood cells. So that mold causes this like global across the body mitochondrial deficiency. And like we were talking about with the fatigue, it's going to show up in the more demanding tissues. COVID shows up a little bit differently. So this is when I'm sitting with somebody and I'm trying to parse it out. First of all, I have a questionnaire to help myself out. I developed over the last 20 years of just like, what are the symptoms? And let's give it a score so we can kind of quantify this. And that's in my book, Break the Mold. When I'm sitting with a COVID, is it mold? Is it Lyme? COVID's got this really goofy thing where we know that the ACE2 receptors are the target of one part of the spike protein, which unfortunately mast cells highly, highly express ACE2. So we're seeing a rise of mast cell activation. So that's somebody is saying, well, I must still be in mold because I'm having mast cell problems. And I'm like, well, you could have a good, successful remediation and COVID hanging around in your body, agitating the mast cells. So it can be a clean bill of health on the mold side and COVID causing the only problem for the mast cells. Then there's this other part of the receptor that nobody's really paying attention to, which is binding with really, really high affinity, which means like a sticky, sticky magnet or a fish hook. I think of it almost like a fish hook into these receptors that drive our autonomic nervous system. And they're called nicotinic receptors because nicotine also binds to those. So it's a alpha 7 acetylcholine nicotinic receptor. Acetylcholine drives our whole autonomic nervous system. And so people that have long COVID, because of their spike burden, because it's lodged into that receptor like a sticky magnet or a fish hook, these people their autonomic systems aren't driving well. So we're going to see changes in respiratory rate, blood pressure, hydration of the eyes, gut motility, these very specific things that we know. Sweating, not sweating. I can't sweat since COVID. I'm like, okay, that's not a mold thing. I mean, it can be. This is highly correlated with being, burdened with spike protein, and we can bump the spike off that receptor using nicotine.
Mm-hmm.
It's just amazing how it works. But if we do that, now we have this free floating spike that causes clotting bleeders. So we don't want to necessarily increase someone's clot potential. So we have to have things on board first that are going to help to digest the spike and to stabilize those blood vessels. And then we can add the nicotine. It's very elegant. I mean, I've had people calling, just crying. They're like, I've had migraines for 3 years and it was gone in 2 days on nicotine. Or,
Mm-hmm.
I couldn't stabilize my blood pressure. I kept fainting and I was a week on nicotine and it's completely gone. And of
Mm-hmm.
course, it's not just the nicotine. It's all the stuff we did to support them. And then we add that as the last
Mm-hmm.
piece. I mean, it is amazing. So there are some ways that we can look at symptom pictures, knowing the mechanism of these invaders, we might say,
Mm-hmm.
and really parse it out and be very precise with our treatment. And it just gets to the end faster. I'm very impatient as a practitioner.
Yes, everyone wants to get well fast, but there's a
Yeah.
process. But I love that you brought up the nicotine patches because that is something that, you know, if you look online, it's going to be misinformation. And
I've gotten majorly censored on this.
oh yeah, I
I even wondered if I should like mouth it and not say it
yeah,
on your podcast so you don't get in trouble. But if
that's
anybody
okay.
wants my
No,
protocol, email
yeah.
me. Again, we have the whole protocol in an emailable format.
Yeah.
So
No,
yeah,
thank you for saying that. And I too have, you know, seen many people that have improved on the nicotine patches and it's crazy because I mean so many people think, "Oh, nicotine, it's so, I don't they've taken the shot, they've taken lots of other things and medications, but they're afraid to put
oh, I
on
know.
low
I
dose
had a
nicotine patch. Yeah.
yeah, I have a parent who they're facing, do we put our son on a biologic for his GI problems? And in his case, the long COVID is only showing up as GI problems. And I'm like, you're about to put him on chemo, but you won't try a
Yeah.
nicotine patch? Like, let's just slow down here a second and realize how much programming there is behind this nicotine thing.
Mhm.
Does smoking and chewing cause cancer? Yes. Is it the tobacco? And no, it's what did I count? 630 some chemicals added
Mhm. Right.
to make it more addictive.
Mm,
So does it create tolerance? Yes. So that's a different thing than addiction. And
mhm,
we can manage tolerance with theanine. And that's all in that handout.
mhm.
Like it goes
Awesome.
through how do you make sure the receptors stay down? Because if you are creating tolerance to nicotine, that means you're creating more of those receptors. And remember, those receptors also bind spike protein. So it makes you more of a target. If you
Mhm,
are doing continuous use, you need to be doing something to modulate those
mhm.
receptors back down. Yeah.
Well, thank you for having those resources available online. That's very generous of you. And, that's what we need. We need resources that people can go to without having to jump through a bunch of hoops to find answers.
Yeah.
Which is so frustrating because you get online or Facebook or Instagram or somewhere and you type in something and then you're going to see polar opposite opinions from different people who claim to be experts. And it's just so confusing. And I love that you have so much education you offer. You've written some amazing books. I was just mentioning before we started recording that I had just purchased the her book that I recommend everyone who has a child or a grandchild or children. So basically everyone. A Light in the Dark for Pandas and Pans because there's been you talk about autism spectrum and other, just some behavioral changes in children. And immediately, like people go to, you know, things like you hear autism or other things and they think, okay, this is just, something we're just going to live with. This is their diagnosis forever. But maybe if you could talk a little bit about pans and pandas for a parent that might be feeling like they're going crazy because their kid is suffering and they don't know what to do and they've gone to their pediatrician and get slapped with this label of these different labels
Yeah.
and then
Right. Right.
stuck with that.
Mhm.
There is hope though.
Yeah. So much hope, so much hope. Yeah. So anxiety is the most common symptom that we see with pandas and pans. So most of the time, these kids are getting given a label of anxiety disorder and
Mhm,
then given some sort of neuropsych medication. The problem with that is we're still not treating the cause. And
mhm,
second problem is these kids, due to the mechanism of their disease or their illness, I'm not going to say disease. Let's reframe that to illness because that's
mhm,
treatable. Due to the mechanism, they have leakier brains. So what we would normally give, even in a kid dose, is going to be felt by their body 8 to 20 times higher than, even if the doctor is doing the most prudent, careful medicating that they can do. So let's both treat the cause, but also understand they have leaky brains.
mhm,
So anything that we give, they're going to be really, really sensitive to. We
mhm,
also see OCD, so obsessive compulsive disorder in kids. That's also a very common diagnosis they get pre-identifying that it was pandas or pans.
mhm,
And then tic disorder, so a kid that develops a tic or something like that. So those are kind of the three things, anxiety being the leading cause, and it could be separation anxiety from a parent. Their bedroom is the typical thing, like their safe space. And if you think about the thing that leads up to these conditions, and I'll explain what they are in a minute, the thing that leads up to this is an immune depleted state. And then they got an exposure, whether that was infection or environmental or both. And their body just wasn't up for it. Their immune system wasn't up for it. And so it can kind of trip a trigger into an autoimmune condition. So pandas and pans are very similar in how they look clinically. That's why we kind of lump them together. But the thing that triggers them is different. And they are autoimmune conditions where the child or the adult who got it as a teen and is now grown into an adult, which we see a lot of adult pandas pans. I think there will be an andas ans, which is adult associated, whatever.
mhm,
Um, so then I just lost track. Oh, so their immune system is now attacking their own brain. And we also see some generalized abdominal pain. So there's theory that either the part that's being attacked in the brain is correlated to the brain chemistry we make in our gut, because 70% of our brain chemistry we make in our gut.
mhm,
So they're thinking that, it's the gut brain connection. To those of us doing natural medicine, functional medicine, we're like, well, duh, but we have to find the mechanism and we have to understand the cells involved. So yeah, basically their immune system just went on tilt and started attacking their own brain, and it's in the survival part of the brain. So they become very fearful of the world, and that's where we get that separation anxiety. And it's wisdom of the body saying our defenses are down, you
mhm,
know. Why would we go to school and get exposed to all that stuff? My defenses are down. And if I get exposed to something, now my body will attack my brain. So when we start to really honor what their compulsions are, we can learn a lot about where we can support the kid. And I talk about that a lot in the book, how to identify, like, if this is the compulsion, here's the support, you
mhm.
know? Yeah.
Yeah, that's great. And then also, I didn't start out with explaining to someone who might not be familiar with PANS and PANDAS. What does that stand for?
Yeah. Pandas is pediatric autoimmune disorder associated with strep. So that was the first identified one. And then they started to see, oh, in some of these kids, they don't have strep or we couldn't find it. So it's got to be, we need to broaden that clinical criteria. And so PANS is pediatric acute onset neuropsych syndrome. And the
Mhm,
acute onset is one that we're lumping in a lot of kids also, though, who have congenital infections, such as Lyme disease that they got from mom when they were in utero. Those kids won't have as much of an acute onset, but we don't have anywhere else to put them. So that's in that category as well. So there will be an overnight change. It just may not be exaggerated like you might see in some of the support groups that they're like, the kid was completely normal and, what do we normalize these days? Normal is not healthy, right?
mhm,
So usually these are kids that they're not winning attendance awards at school. These are kids that miss every so often, and when they get sick, it takes a little bit longer. And we kind of send them to school and they're still kind of wimpy sick, and then that's our sign right there is like, no, 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 kids should be better by. If you give them a good amount of time to recover, they should be better. So that's when the warning signs should be out there in our culture. But we don't. We just speed right past it. And then it sets the stage for this to happen. So people will say, okay, my kid was completely normal. And, I'm saying normal in air quotes for people that are listening. And then they got sick. And then 3 weeks later, overnight change. All of a sudden, won't leave their room, washing their hands like crazy, some kind of OCD type of behavior. Or in a teenager, it might be regression. They start talking baby talk. In a, 7-year-old, they might start wetting the bed. I mean, there are lots of behavior changes as well that come along with this. And these conditions are really causing a paradigm shift in the mental health field because and COVID really helped with that actually, because people were like, oh, an infection can cause depression. An infection can cause anxiety. An infection can cause neuropsychiatric symptoms. Yeah, you know,
Yep.
and those of us treating Lyme, mold, COVID and pandas and pans, we're all like, yes, this happens more often than we're giving credit. And if we really were going to honor treating the cause, we do a little investigation. And so often we find some, random food allergy or, immune deficiency or lifestyle, something that is causing or kind of setting the stage for somebody to have more brain problems from their body
Mm-hmm.
illness.
And can
Mhm.
you talk a little bit about maybe the correlation with um, intolerance to gluten and dairy that a lot of these people have, and why would
Mhm.
they have that?
We see that more so in the autism group. So pandas and pans is very different than autism, even though we might find kids who have both.
Mm-hmm.
And so basically this is and there's lots of theories about why it's working. If a kid has autism, we take them off the gluten and the dairy and they feel better. I think on a truly energetic plane, these are foods that we are abusing.
Mm-hmm.
And that's not a clean exchange, and our kids are telling us that. So when I go way to my woo side, it's like, well, of course, because we're not respecting those living beings.
Mm-hmm.
And from the gluten side, is it guilty by association? Question mark, because I have patients who can go to Europe where they don't spray with glyphosate
Right.
and they do just fine.
Mm-hmm.
And we in the US, though, even organic foods, some are allowed to be sprayed at the very end to like sprayed to kill the plant. So excess what you would use in the growth stage just before harvest to desiccate it, to get all the water out of it. So it's
Mm-hmm.
like those little desiccant plants, or if you've ever made like eggplant parmesan, you chop up the eggplant, you salt it, and then you wait, and all the water comes out of it, and then you can put it into your dish and it'll soak up all the sauce. Like it's an old trick for
Mm-hmm.
cooks. Well, we can do the same thing with wheat out in the field. They can go by with the glyphosate and it will kill the plant and then suck all the water out of the wheat. And that makes it easier to harvest. So I wonder how much of the gluten intolerance is a cross reactivity with glyphosate. It's
Mm-hmm.
not like we're taking the gluten and purifying it of all the glyphosate.
Mm-hmm.
So for some of my families, though, even organic gluten, they still get a reacted kid.
Mm-hmm.
And so I think that there's some cross reactivity with the proteins that's what we see with food allergies. There's a
Mm-hmm.
cross reactivity of the protein in the food with something that has invaded the body that looks so similar in protein shape and size that when you eat it, the immune system says, we're being attacked by that thing again. And then it attacks the food. And we see that a lot with strep and dairy.
Mm-hmm.
Yeah.
Yeah. And do you see, do you ever kind of go off on the low stomach acid, like down that, like treating, because
For
that's
sure.
something that I know is very prevalent in almost everyone that I, you know, talk to, work with. There's a level of low stomach acid that is making, setting the stage for opportunistic infections and also not being able to digest the protein, break it down. There's B12 deficiencies, there's anemia, there's, just that whole ripple effect, and then leaky gut and all those things. So just,
Mm.
Yeah.
Yeah. So, I mean, I had to take boards on this in medical school. Like in naturopathic medical school, stomach acid was such an important part.
Mhm.
And we used to do the old Heidelberg test where you'd swallow a string and then you'd have the person like after a couple minutes, like cough it up and then you would pH it. And so many people had low stomach acid. It was shocking. Now they
Mhm.
have a little cool bot pill that you swallow and it can track it. It's a really cool test.
Oh, that's fun.
Um, so yeah, you can
And there
actually,
and there is that the home self stomach acid test with using the betaine and just, trialing
Mhm.
it and waiting until you feel that, taking it until you feel the burn. But yeah.
Yeah, that gets a little tricky when we have mold because mold causes nerve damage.
Hmm.
So if somebody has mold exposure, I don't do the ramping, the stomach acid test because they're not going to feel the burn. And then we could go far over the acid count and actually cause damage to the stomach.
Hmm.
So that is one thing I will rule out, if we think, okay, it's stomach acid problem. And mold is really connected to this. Mold causes low stomach acid because it causes the next step in the digestive cascade to get gummed up and slowed. And so the body in its wisdom says, wait, that pathway isn't working, slow down stomach acid. So, and even sometimes slow down appetite. Like people will get changes in their appetite with mold. Initial will be a lower appetite, and then it becomes a high appetite because they're not absorbing their food. So they're continuously hungry and eating,
Hmm.
and still losing weight. And also losing the wrong kind of weight because then people will get weight gain from mold. And that's a leptin resistance thing. That's a very different thing that's going on. So it's just so many mechanisms. But yeah, so we will see low stomach acid because the bile part, so the stomach acid and the betaine inducing bile formation and flow, that gets blocked right there. And so they can have lower digestive juices all the way down the cascade gets blunted. And then we also have the neurotoxic effect of the mycotoxins, even if you're not eating them. So if you're smelling them, that goes into our bloodstream right away. They're fat soluble. So the toxins for mold, and I should explain, mold can make you sick with spores and then fragments of the spore. So if a spore is broken off, it has chemicals when it's metabolizing, and then it has mycotoxins. And the mycotoxins aren't made all the time, but they are made in a competitive environment. So if somebody is being exposed to a mycotoxin, there's more than one mold in that environment and
Hmm.
then more than one mycotoxin because they're warring with each other. We aren't the target of that, but it has all the same biological effects on us. The
Hmm.
reason they make the mycotoxins because they're defending their territory and they want to be the only type of mold or species there. And the mycotoxins that they're making are to kill another living organism.
Hmm.
Bad intention, that's a really think about that. It's like, okay, yes, you can get bacteria and endotoxins and actinomycetes in a water damaged building, but those aren't making a toxin poison on purpose. Mold is. So
Hmm.
that's why it gets so much of my attention.
Hmm.
Yeah. So if you're breathing in the mold, and the mycotoxins, because they're fat soluble, they don't need an escort to get into the body. It goes immediately into the bloodstream. When it gets in the bloodstream, the body tries to detoxify it through the kidneys, through the liver, and through the gut. So it'll start to send a lot of that yucky blood to the gut for we have like little mini appendixes all along the outside of our gut. So it's trying to have all that part clean it up. Well, unfortunately, having that gut lining accumulate these toxins is the same as if you were eating them, has the same gut paralyzing effect
Hmm.
and microbiome changing effect.
Hmm.
Yeah.
Yeah, that's so interesting. And then you think of hormonal imbalances, like how that affects just the domino effect of all of this. Because oftentimes people want to jump ahead to, okay, well, let's just, focus on hormones. Let's focus on getting, because well, but there's so many layers and you've got to get down to, there's all these root causes, but addressing them in the proper order is so important. And a lot of times, our bodies, like I know you believe too, is our bodies were made to heal. They're very intelligently designed. We just need to give it the right things and help it do that.
Yeah.
So I
And
think.
sometimes that's crutches. Sometimes that's hormone creams and those kinds of things.
Mhm.
But not for the intention of like, okay, we're done.
Yeah, right.
No.
Right, right. You
But
want to
like,
go at
here's
it
your
from,
crutch. Let's get
yeah.
the mycotoxins out of your bile so you can actually make your own hormones again. Yeah.
And so what about the person who's listening and like, okay, I'm gonna go, get on some stuff to detox myself and try, can you talk a little bit about like, okay, wait, how do they approach this and who they need to approach about this and also maybe touch on like biofilm and how there's, things like that when you're trying to heal and you're like, I'm taking all this stuff, but yet you still have this biofilm that's hiding a lot of things and maybe
Right.
your drainage pathways are not open.
hmm Well, first of all, if you can't poop, that's the place to start.
Yeah.
Because if you're doing drainage, which is at a cellular level, where's it got to go? It
Mm,
needs to go into the lymphatic system, which then gets, eventually tracked into the gut. Well, if you're not pooping, then that means 2 regular bowel movements every day. Not like I'm not constipated. I go every other day. That's constipated.
mhm,
So at minimum, 1 bowel movement a day. And it should be easy to pass. It should be well formed. It should sink. Just all of these very basic things. You can look at the Bristol stool scale. You want to have a normal BM every day and ideally 2. So if that's not happening, that's where we start. That's your detox that you need to do because that's going to detox lots of other waste products as well. Not just all this mold stuff, but especially the mold stuff. So if you're constipated, where it's getting blocked up, like we talked about, is at the bile level. So you could be using all the laxatives in the world, vitamin C, magnesium, senna, stool softeners. That's not where the blockage is. The blockage is higher up. And so often what we will do is add bile salts or bitters or things that will make and move more bile. And if that's not working, then I add the HCl. And some people have been so constipated for so long, we have to start with the laxatives to clear out the lower part of the colon and then add the bile stuff and then add the HCl if needed. So it's like we start at the bottom of the tube and work our way up. But people are, they've come to see me and they're like, no, 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 I've tried everything. I've tried everything. And I'm like, well, tell me what you've tried. And it's all stuff that clears out the lower part of the colon. And I'm like, well, when it's mold, you didn't go high enough in the tube. We have to get up there to the bitters and the bile and these things called cholagogues. They're plants that make and move more bile.
mhm,
So that would be number one. It's like you got to be pooping. That's just general health health in general. But when it's mold specifically, I kind of have 5 steps or methods or ways that I think about it in order. Um, and when I went to write my book, I thought, well, it's not really like peeling an onion because that's how we heal. The body tends to, peel the last condition off first. And so you can see like a sinusitis or a mono that you had, huge lymph nodes when you were 17 show up when you're 42 because you're finally cleaning yourself up and you're like, what's this? I thought I should have had this since I was 17. Like, oh, that's peeling the onion. That's just kind of how the body heals itself. So that's a healing order, but I was like, this is a therapeutic order. What exactly am I describing? And it was an orange because the first 2 steps of my 5-step method really have to be done 100% or people don't get better. So the 5 steps is avoidance, the fundamentals, protect, repair, and fight. And I have it in that order because I've messed up before. And it was years and years and years of, honing the method to try to make sure I could get people well with more ease. Because if you, like you were talking about, if you try and race to the finish, you can make yourself a lot sicker. Like you can overwhelm your body's ability to detoxify, and you can actually cause organ damage. Like it's not just you're feeling fluey because you walk through a flu cloud or something. Like no, you're feeling fluey because the organs are literally giving enzymes like a liver enzymes that's saying this is way too much for me and like this cell is getting damaged. So caution. Just be careful and caution. And the very first step being avoidance is the most important part. 50%, about 50% of people just feel better getting out of the mold exposure. So
mhm.
getting out of that building, remediating, having your boss change you to a different building. If you're a teacher, that's really tough. We got a lot of moldy schools. So, banding together with other teachers and being like, we've got to fix the roof, we've got to remediate this school. You're going to see better behaved kids, by the way.
Hmm.
So, whatever you need to do to be out of that exposure, that's the most important place to put your effort and energy. Because you could be one of those people that you just get out of that exposure and you regain your health. Half the people don't. And that's what all the rest of the steps are for. The fundamentals, the second step is diet. Diet is a superpower for mold. It is the difference between the people that get well quicker and the people that take a long time are the people that really dedicate themselves to that low mold mycotoxin, high binder diet. And it's not a lifetime diet. I believe that everybody should be able to eat anything all the time. So, within reason. But that's, if you had a race car, you wouldn't feed it gross fuel, So we want to do the same thing with our bodies, just set it up for success. And there are specific things that we can take away, which would be things that tend to be like an anti-candida diet. But
Hmm.
I also add, I take away all mushrooms because I don't want to reinforce the message that fungus is coming to move into you, like it's
Hmm.
trying to invade you. So just for a little while, we go off of anything that's in the mushroom family, including medicinal mushrooms. And then what do you focus on is things that are high in color, because we see that helps the kidneys detoxify these mycotoxins and the other mold toxins. Things that are gonna like love the liver, like things high in something called sulforaphanes, which I'm sure you talk about a lot. So the broccoli family, the Brassicaceae family, and then things that are like we know they're good for detoxification, like curcumin or turmeric. Curry is a beautiful food because you can get that, you can put some chicken in it, you get your proteins, you get your mixed veggies and some curry and some coconut milk, and voila, you have a dairy-free, gluten-free, beautiful meal. And then good fats. We find in animal studies that the more the animal had the good fats, specifically DHA, which is from fish oil, the more protected they were from the mycotoxins. So their cells would actually shove the mycotoxin out if it had enough DHA. So those are just kind of some dietary things. And then protect, repair, and fight. That's all about like getting the body ready for the fact that there's going to be more mycotoxins getting spilled, because when you do the fight, meaning antifungals, mold will fight back by making more mycotoxins inside your body. It's
Yeah.
very smart.
Hmm. It is. So, talking about like turmeric, for instance, when
Mhm.
you're dealing with a child that might be extra sensitive, what should you consider with some of these things like what you just mentioned? Because everyone thinks, I mean, I know for myself and my children, like it's amazing. Turmeric is awesome when you like as a natural anti-inflammatory, that we
Right.
we use often. But when should turmeric, for example, be something that you are like, no, it's not just a band, like everyone can use.
Right.
Yeah.
No, now wild abandon, not with turmeric. Thank you
Mm.
for bringing this up because I do have a caution list of herbs in my Pandas Pans book. Pandas and Pans changes all the rules. So once that trigger is tripped, where now it's autoimmune and now the immune system is attacking certain parts in the brain, the parts in the brain are related to dopamine. And so these receptors get destroyed and the kids get too much dopamine in their brain, too much of this brain chemical that is considered excitatory. We have excitatory and inhibitory. Serotonin is an inhibitory neurotransmitter. That's what a lot of antidepressants, like it's the happy hormone or happy neurochemistry. Dopamine is the excitatory, which makes sense why we're getting anxiety,
Mhm.
extra movement disorders, those kinds of things. Turmeric, unfortunately, is dopaminergic, which means it can increase dopamine. And that is actually not a plant that I use with kids with pandas and pans. So
Mhm.
that's strictly a mold thing. And when we veer into, okay, now it's pandas and pans, then I have a list in my book about the ones that I don't use because they will increase dopamine in the body. And a lot of them are like things you would think. I learned this the hard way with my own kids. I have twins with pans. And I was like, oh, I'm going to give him a bunch of lemon balm and we're just going to have a chill night and it's going to be wonderful. And so I made this, I had it in my garden. I was like making our homemade tea, added a little lemonade. I was like, this would be so nice. We're going to have a chill night. My kids did not sleep that night. And I'm like, this is lemon balm. What in the world? Of course, I'm drinking the tea too. And I'm like, I'm trying to stay awake. And then I was, as more information came out about the mechanism behind pandas and pans, it was like, oh, dopamine. Okay, now that totally makes sense. Passion flower, boswellia, all these things that you're like, quote, good for the brain. When it comes to pandas and pans, it's not autism. It's not Alzheimer's. It's not Parkinson's. It's its own animal and it has its own rules.
Right.
Yeah.
Yeah. Thank
Thanks
you
for
for
asking
explaining that.
that.
And
Mhm.
one last thing, I know I wish we could talk all day because,
I know we could.
but so could you talk a little bit about POTS and
Sure.
what POTS is and the correlation because there's a rise in POTS right now.
Huge rise. And it's all the same. There's actually a something called a pentad, which is these conditions that are found together a lot. And mold is a very common cause for the pentad to happen. And then you add mold and COVID, and it's just all those mechanisms I talked about earlier. It's not only the mitochondrial deficiency, but it's the autonomic nervous system disruption. So POTS is postural orthostatic tachycardia syndrome. And it basically is the people whose autonomic system doesn't accommodate to changes in elevation or changes in body positioning. So if I were to stand up right now, really quick, my nervous system is supposed to say, oh, she stood up. And then my blood vessels are supposed to squeeze to make sure that when I stood up, my blood volume still was coming up to my brain.
Hmm.
And we talked about the hungry parts of our body, the brain, the eyes, and the heart. If you stand up too fast, if anyone's ever done this, like down, crouch down and then you stand up too fast, sometimes you can get like see stars.
Hmm.
That's what that is literally you're not getting enough oxygen to the backside of the eye. And with POTS, then the body says it's like a little bit of a delayed response for everything that's in the autonomic running system, which is our, I talked about, it's like tears, making tears. You don't think about, oh, I need to make a tear right now, like that's all happening behind the scenes. So when the person stands up or they're standing for a long time, the autonomic nervous system is not communicating very well with the brain and the eyes and the inner ear that's saying, here's our position now. So all these communication things that are going on in the background. So the body says, well, we're not getting enough oxygen to the brain. Let's just speed up the heart rate. Let's just make it move faster. And then maybe we can, get some oxygen up there and not have the person faint. So
Hmm.
it's all this accommodating to a delay and a asyncope that's going on with the autonomic nervous system. You're trying to live your life, but your body's not keeping up with it, basically. So POTS is one of the pentad. Mast cell activation is also in that, and we kind of explained why that would be with COVID because the ACE2 receptor is highly expressed on the mast cell. And
Hmm.
then if it's getting attached to the mast cell, it gives it more chance to stick into that nicotinic receptor. So you get two binding sites.
Hmm.
Um, Ehlers-Danlos is in that, and that's a lot. We're seeing that hugely on the rise, and that's not a genetic increase. That is the autonomic nervous system not managing posture, basically.
Hmm.
Just your basic tone. And we see that a lot with kids who were born with Lyme. They have what's called atonia or dystonia, and a lot of dysautonomia with that. The word, well, and there's the other one, dysautonomia is
Hmm.
part of that, which means your autonomic nervous system is not working. And that has certain criteria, clinical signs and symptoms, but they look a lot like POTS and Ehlers-Danlos, interestingly enough. And
Hmm.
then gastroparesis, meaning that the normal function of your digestion has that asyncope. It doesn't quite work. So
Hmm.
when you eat, it takes your nervous system a long time to say, oh, we ate. And so you can get kind of a slowing of the stomach and the digestion. And then things don't work appropriately. So you can get that can lead to more SIBO and those kinds of things.
Mm-hmm.
So mold being with the mycotoxins being nerve toxins, the
Mm-hmm.
more we can get those nerve toxins out of the body, the more we can get that autonomic system running better again. That's
Mm-hmm.
the kind of correlation, how we got there. Mhm.
Yeah. No, that you explained that beautifully. And I think, like there's a lot of people doing things to stimulate their vagus nerve and try to help with that. But again, that's just, that can be something that's beneficial, but that's not getting to the root of it. Those
Right.
are all great, modalities to help. But yeah, I so appreciate you coming on today. Thank you so much, Dr. Kim.
Yeah, thanks for letting me get so technical too. I love talking to other healthcare practitioners, trained people. It's like, yeah, you have good questions and then I can really, go deep.
Yes, that you explain
I
things
hope it
on a
helped
level.
people.
Yeah, you explain things on a level for everyone to understand, and you have the resources there that people can get. And so I will post that on the description of this podcast. And I hope that a lot of people get help by listening to this and going to your resources. Thank you so much for joining me, and I hope we get a chance to talk again sometime.
Sounds good. Thank you for the honor.
Thank you.